There is a quiet but powerful truth in medicine that often goes against instinct. Not every diagnosis requires immediate action. When people hear the word cancer, the natural reaction is urgency. Fight it, remove it, destroy it as quickly as possible. But prostate cancer, in many cases, does not follow the aggressive pattern people fear. It can grow so slowly that it may never cause harm during a person's lifetime. This reality challenges the deeply rooted belief that all cancer must be treated right away. In certain situations, choosing not to treat immediately is not neglect. It is a carefully considered, evidence-based approach. This strategy, often referred to as active surveillance, involves closely monitoring the cancer through regular checkups, blood tests, imaging, and sometimes biopsies. Instead of rushing into surgery or radiation, the focus shifts to understanding the behavior of the cancer over time. If it remains stable and non-threatening, intervention can be safely delayed or even avoided altogether. This approach recognizes that treatments themselves carry risks. Procedures like surgery or radiation therapy can lead to lasting side effects, including urinary incontinence, erectile dysfunction, and bowel issues. These are not minor inconveniences. They can significantly affect a person's quality of life, sense of identity, and emotional well-being. When the cancer itself is unlikely to progress or cause symptoms, exposing a patient to these risks may not be the most compassionate or rational choice. There is also a psychological dimension to consider. Living with untreated cancer can sound frightening at first, but for many patients, it becomes a journey of awareness rather than fear. With proper guidance and consistent monitoring, individuals often develop a deeper understanding of their condition. They learn to distinguish between real danger and perceived threat. This shift in mindset can replace panic with calm and helplessness with a sense of control. Medical science has advanced to the point where doctors can often predict which prostate cancers are likely to remain slow-growing and which may become aggressive. Factors such as PSA levels, Gleason scores, and imaging results provide valuable insight. This allows for a more personalized approach, where decisions are based not just on the presence of cancer, but on its specific characteristics. It moves medicine away from a one-size-fits-all model and toward thoughtful, individualized care. Another important aspect is time. Time allows for observation, for patterns to emerge, and for better decision-making. Acting immediately may feel reassuring, but it can sometimes close the door on better options that become clearer with patients. By allowing time to reveal the nature of the disease, patients and doctors can make choices that are more aligned with long-term well-being rather than short-term fear. Family and societal expectations can also influence decisions. There is often pressure to do something because inaction can be misunderstood as giving up. However, choosing surveillance is not passive. It requires commitment, discipline, and trust in the process. It is an active decision to prioritize balance over impulse and wisdom over fear. This perspective invites a broader redefinition of what it means to fight illness. Fighting does not always mean aggressive intervention. Sometimes it means protecting the body from unnecessary harm. It means respecting the body's natural course and recognizing when intervention adds more burden than benefit. It also means trusting that careful observation can be just as powerful as immediate action. In many ways, this approach reflects a deeper philosophy of care, one that values quality of life as much as longevity. It acknowledges that living well is not just about eliminating disease, but about preserving function, independence, and dignity. It reminds us that medicine is not only about extending life, but about enhancing the experience of living it. For those who choose this path, it becomes a practice of patience and awareness. Each checkup becomes a moment of reassurance, each stable result a quiet affirmation that waiting was the right choice. Over time, the fear that once dominated the diagnosis often softens into something more manageable, something that no longer controls every thought or decision. Healing is often misunderstood as a simple equation. Remove the disease and the person is healed. But human health is far more complex than that, especially in conditions like prostate cancer, where the disease may not always be immediately life-threatening. The meaning of healing extends beyond the physical presence of cancer cells. It includes how a person feels, functions, and lives each day. It includes dignity, comfort, independence, and emotional stability. When treatment is considered, It is not just about what is medically possible, but also about what is truly beneficial for the person as a whole. Medical interventions such as surgery, radiation, and hormone therapy can be effective in controlling or eliminating cancer, but they often come with consequences that affect the body in lasting ways. Some men experience urinary difficulties, changes in sexual function, fatigue, or bowel complications after treatment. These effects can alter daily life in ways that are deeply personal and sometimes unexpected. For some individuals, the trade-off between removing cancer and preserving bodily function becomes a difficult balance to navigate. This is where the broader understanding of healing becomes essential. Healing is not only about survival statistics or laboratory results. It is about how a person experiences their own life after treatment decisions are made. A treatment that successfully removes cancer but significantly reduces quality of life may not always feel like a complete success to the person living with the outcome. On the other hand, careful monitoring without immediate intervention can allow individuals to maintain their normal routines, relationships, and physical comfort for longer periods of time. There is also an emotional layer to healing that is often overlooked. A diagnosis of cancer can bring anxiety, fear, and uncertainty. The idea of undergoing invasive treatment can intensify those feelings. In contrast, choosing a more conservative approach in appropriate cases can reduce emotional stress. Knowing that the condition is being closely monitored by medical professionals can provide reassurance, even if no immediate treatment is being performed. This sense of watchful care can help stabilize emotional well-being during an otherwise uncertain time. Healing also involves identity. Many individuals define themselves through their physical capabilities, independence, and sense of control over their bodies. When aggressive treatments disrupt these aspects, it can affect how a person sees themselves. Maintaining function and routine, when medically safe, helps preserve that sense of identity. It allows individuals to continue engaging in their hobbies, work, family roles, and social life without major disruption. These elements contribute significantly to overall well-being, even if they are not always considered in traditional medical decision-making. Another important aspect of healing is time. The human body and mind often adapt gradually to health conditions. In situations where disease progression is slow, time becomes an ally rather than an enemy. It allows space for reflection, second opinions, and evolving medical understanding. It also gives patients the opportunity to adjust emotionally to their diagnosis without being rushed into immediate intervention. This slower pace can lead to more thoughtful and balanced decisions that align better with personal values. Modern medicine increasingly recognizes the importance of individualized care. Two people with the same diagnosis may have very different experiences, risks, and preferences. What feels right for one person may not be suitable for another. Healing, therefore, becomes a personalized journey rather than a standardized process. It involves shared decision-making between patient and physician, where both medical evidence and personal priorities are taken into account. There is also a growing understanding that less intervention can sometimes lead to better long-term outcomes in carefully selected cases. Avoiding or delaying treatment can help prevent unnecessary side effects while still maintaining safety through regular monitoring. This approach does not ignore the disease. Instead, it manages it in a way that respects both medical knowledge and human experience. Healing, in this broader sense, is about maintaining balance. It is about ensuring that the pursuit of cure does not overshadow the importance of living well. It is about recognizing that health is not only measured in medical reports, but also in laughter, movement, relationships, and peace of mind. It is about understanding that sometimes the most meaningful form of care is the one that preserves the wholeness of a person, rather than focusing solely on the removal of illness. Time is often seen as something working against a person after a diagnosis, especially when the word cancer enters the conversation. It creates urgency, pressure, and a feeling that decisions must be made immediately or consequences will follow. But in reality, especially in certain forms of prostate cancer, time can behave very differently. Instead of being an enemy, it can become a powerful tool that supports better judgment, safer choices, and more balanced living. In many cases, prostate cancer does not progress rapidly. It may grow so slowly that it remains stable for years without causing symptoms or spreading. This slow nature changes the entire meaning of time in medical decision-making. Rather than rushing into treatment out of fear, patients and doctors can observe how the condition behaves. Regular monitoring through blood tests, imaging, and clinical evaluations allows time to reveal patterns that are not immediately visible at diagnosis. This observation period is not wasted time. It is valuable information gathering that helps avoid unnecessary or premature intervention. When time is embraced in this way, it reduces the risk of overtreatment. Immediate aggressive treatment might seem like the safest choice emotionally, but medically it is not always the most beneficial. Some treatments can cause side effects that permanently affect urinary control, sexual health, or energy levels. If the disease is not actively threatening health in the short term, delaying intervention can protect quality of life. Time allows the body to remain unchanged, while the true nature of the disease becomes clearer. Time also plays an important role in emotional adjustment. A diagnosis can feel overwhelming at first, and decisions made in the early emotional shock may not always reflect long-term preferences. As days and weeks pass, fear often settles, and clearer thinking emerges. Patients begin to ask deeper questions about what matters most to them: comfort, independence, daily function, or longevity. This emotional settling process is essential because it leads to more thoughtful decisions that align with personal values rather than immediate panic. There is also a biological advantage to time. Medical understanding of prostate cancer relies heavily on tracking changes over time. A single test result provides a snapshot, but repeated measurements show direction. Whether the condition is stable, slowly progressing, or changing more quickly becomes clear only through observation. Time transforms uncertainty into measurable information. This reduces guesswork and allows treatment to be introduced only when it is truly needed. Another important aspect is that time gives space for medical refinement. Diagnostic tools and treatment options continue to improve. A patient monitored over time may benefit from newer, more precise technologies or updated clinical guidelines that were not available at the moment of diagnosis. In this sense, waiting does not mean missing opportunity. It can mean gaining access to better options in the future. Time also helps reduce unnecessary urgency in decision-making. When everything feels urgent, choices are often driven by fear rather than understanding. But when there is time to think, research, and consult multiple perspectives, decisions become more stable and confident. Patients are able to explore second opinions, understand risks more clearly, and discuss options with family members without pressure. This leads to decisions that feel more aligned and less regretful later on. There is also a psychological shift that occurs when time is reframed as an ally. Instead of viewing each passing day as a delay, it becomes part of a structured plan of observation and care. Regular checkups replace uncertainty with reassurance. Each stable result becomes a reminder that immediate intervention is not always necessary. Over time, this builds trust in the monitoring process and reduces constant worry about what might happen next. In some cases, time even reveals that treatment may never be required. Certain prostate cancers remain so indolent that they never progress to a stage where intervention becomes necessary. In such situations, years of monitoring confirm that the safest course of action was simply careful observation. This outcome highlights how powerful time can be when combined with proper medical supervision. Time also protects against unnecessary loss. Medical interventions, while life-saving in some situations, always carry trade-offs. By allowing time to guide decisions, it becomes possible to avoid treatments that may not provide meaningful benefit. This preservation of physical function, emotional well-being, and daily comfort can have long-lasting positive effects on overall life experience. Ultimately, time changes the relationship between patient and disease. Instead of a sudden battle, it becomes a monitored journey. Instead of urgency, there is awareness. Instead of fear-driven action, there is measured response. Time creates space for clarity, and within that space, better decisions naturally emerge.